And with that, I would like to turn the time over to John Britt, who has a stakeholder introduction for us.
Good morning. Share my screen really quickly. All right. I hope everyone's seeing my screen. So every meeting I get to introduce, or usually, hopefully, get to introduce someone. Um, this week, what the purpose of it? Why do we do it? Is to get to know others on the call, maybe build connections that can lead to some collaboration, possibly get ideas for new hobbies. I have. And we get to spotlight the new guy or new girl for 30 to 45 seconds and welcome them here, and we get to have a little bit of fun. So we asked this person what we always ask, what do you like to do to relax or unwind? And this person likes rock climbing. This is a stock photo, and it is not of them, but we could pretend it is because you don't see their face. Interesting facts. They once worked as an ice cream maker. So I wonder if that means they worked at a dairy farm or like Baskin Robbins 31. Maybe we can ask them. How long have you been in EMS, healthcare, and data? 31 years. What do you like best about your job? It helps to improve our service, was the answer. So, any guesses? Welcome, Mr. Shane Baird from Telluride Fire Protection District, who is the EMS coordinator there. As always, if you've not been introduced, you can use this QR code right here on your phone, and it takes literally less than a minute. You can share photos of yourself directly from the phone. And as always, I will put a link in the chat. And that's it for me. Next, Kevin, I think you're going to introduce Dan.
Yeah, thanks, John. Thanks for doing the introduction. Welcome to. I'm sorry, it was Shane Bard, right?
Correct.
I am going to introduce Gam Wijetunge, and he is the director of the Office of EMS. He's going to kind of be covering some of the recent developments over the past week and a half. So, Gam, let's kick it off to you.
Yeah, great job on the last name. Hi everyone, I'm Gam Wijetunge. I'm director of the Office of Emergency Medical Services at the National Highway Traffic Safety Administration, and just want to give you some important updates. So my office is modifying EMS.gov and 911.gov to comply with President Trump's executive orders. The NEMSIS program is funded by the National Highway Traffic Safety Administration and is also being modified to comply with President Trump's executive orders. Currently, there are resources on nemsis.org that are unavailable. Critical patch to NEMSIS versions 3.5 and 3.5.1 will be released in the coming weeks to ensure compliance with President Trump's executive orders. I just want to say I appreciate the patience of everyone here today as we worked through this process together. I realize this imposes quite a burden on you. My office at NHTSA and Clay's team are working quickly to resolve this issue. I'm going to defer any technical questions today to Clay's team, but I'm happy to entertain any questions. Just please understand that there may be some I'm unable to answer at this time.
Yeah, again, this is Clay. Maybe I just share quickly. We've got some folks with some hands up, which is great. If you have technical questions or don't want to vocalize a question, please feel free to add those to the chat. We'd be happy to aggregate those, and we'll provide those back to GAM's office and then after the call. So feel free to either ask questions on the mic or through the chat.
Hey, good morning. Should we just chime in? I don't know if you're calling people out, Clay.
Yeah, Jonathan, go ahead. Yeah, thank you.
Hi. Good morning, everybody. I'm sure there's more to think about, but I'm just curious in this case whether the critical changes pertain primarily to gender or the gender pick list, or is there going to be more than that? I guess that's the one that I saw coming. But if there are others, I'd be curious sort of what they orient around, if you can speak to it.
Yeah, and I'll avoid getting technical here, but yeah, the main executive order that we're working on compliance with is the executive order on defending women from gender ideology extremism and restoring biological truth to the federal government.
Okay. So nothing as far as you're aware that's clinical in nature, as far as actual documentation of medicine. I'm thinking, for example, there's been obviously a lot of discussion around blood products and whole blood administration. Some of these things that are being worked on right now, are any of those changed? Anything having to do with roadway safety changed? Any of those types of things? Or are we primarily looking at the demographics area?
Nothing that I'm aware of, and maybe I'll defer to the TAC team on questions about the specific data definitions.
Gam and Jonathan, the critical patch will only be related to the executive order. So blood transfusion, other things that will be put on hold. We're trying to just make this quick and clean. It will just affect the element for patients, the patient 13, and then a D personnel issue element as well.
Perfect. Thanks a lot.
Thanks, Jonathan. Sundown.
Hello. In regards to those changes, before, when we had questions about the definitions that were used in the data dictionary, for example, for that e-patient field, there was a page on healthit.gov that provided the background and the sourcing for the definitions were used. I had also looked into that recently too in the wake of this, and I noticed that page also is limited. I realize that page is out of your control, but will there be a source that we can look at for the definition that is used when that change comes place?
Yeah, so I'll take a stab at this and then hand it over to Clay and his team. The executive order specifies use of the term sex and defined as male and female. That's what's in the president's executive order. Clay, anything to add?
No, other than Sundown, we knew that those resources had been taken down, but no definitive resources have gone up. So we'll just follow the executive order kind of as closely as we can.
So Clay and Gam, this is Chip. I assume when you say you're doing a critical patch, meaning we've essentially broken the XSD versioning format, you're not limiting the state's ability to continue to collect what we're collecting, because states would probably just continue doing what we're doing. You guys are just limited from displaying that information, right?
We certainly don't have any authority over what states collect, but I'll hand over to Clay for any technical issues about. I know there are many resources that all of you don't have access to through the NEMSIS website right now.
Yeah, and Chip, we're working very hard to structure the critical patch to be as less intrusive as possible. Chip, we're still kind of hammering out some of the aspects of that critical patch, but I imagine in the very near future we'll be able to pass the actual model by everybody so that they can have a chance to take a look at it. But I hear you loud and clear, Chip. We're addressing those very issues.
Okay, and it'll hopefully it'll be easily reversible in a couple of years when all this passes, and you haven't purged the data out of your system, so you can pull it back up again for display when all of this passes.
Right. Again, I think all of the anything that we can do to make kind of facilitate this and make sure that it's a smooth transition, we're working hard on.
This is Karen Jacobson. Related to the question from Chip, I'm assuming that if within the elements that have gender, that only male and female will be allowed through in the XSD. So that probably means all software or state systems will have to map anything that is not gender, male and female. We had a known before or patient not willing to state that those things will need to be mapped to another value. Is that correct? Thank you.
This is Lauren Hogg from Zoll. I have a few questions pertaining to this. The first one being it's obviously critical for any of our daily work to have access to the data dictionary. So does the entire resource need to be pulled down, or is there something that NEMSIS can provide without that sex so that, you know, our teams and our developers are still able to access it and do some form of work? That's my first question.
We are working very hard to answer exactly that question.
The second question is for the 351 timeline. There's not really been a date posted where this is going to be a requirement. Like, will the 351 timeline be able to be pushed back towards the end of 25 if we're unable to even start doing those development for 351 now?
Yeah,
because I don't think that the vendors are going to be able to be ready by summer.
Lauren, in light of the fact that a critical patch will take priority, is that kind of what you're saying?
Yeah, I don't think it should be an expectation that vendors are going to be able to handle 351 by summer with the delay.
Yeah, we'll certainly look into that, Lauren. I mean, I think if we just get, maybe another kind of week or so down the road, we'll be able to have kind of a much cleaner picture. But that makes perfect sense, Lauren.
Okay, sorry, 2 more and then I'll be done. For vendors that are in the middle of compliance processes right now, is there going to be some kind of extension period allowed, considering, we're not able to access those current resources?
Yeah, Jen, do you want to speak to that? I know you were we talked about that. Jen.
Good morning. And thank you everyone for your patience while we work on this, work on complying. For compliance purposes, if you have an expiration within the period where we're working on this, yes, we will give an extension. It will not result in probation.
Okay, thank you. And then the last one is, I know you guys talked about maybe the states having to map something different, but for this interim time period where people are doing something outside of male and female, is there going to be an expectation that the vendors or their states, or is there going to be any kind of bulk resubmissions that we're going to have to be concerned with or plan for? Or are you going to allow the current values in place until the critical patch?
Again, I think that was the expectation, right? Is that it is the critical patch would be the correction. And yes, there will be mapping. Sorry, Karen, didn't answer your question earlier. I had a hard time getting off mute. Sorry.
Again, but you don't think we'll have to plan for any kind of bulk resubmissions regarding that element?
No.
Okay. Okay, thanks. I'm done.
Yeah, great questions. Thank you, Lauren.
All right, just so it can be respectful of GAM's time, we really appreciate you being here, GAM, and like Clay had mentioned, any questions that you think of, put them in the chat, send us an email. We will aggregate them together, put them in a single document, make sure those are delivered to the Office of EMS. Like Gam had mentioned, we're not really sure what level they can respond, but we're also working with some other individuals to try to figure out a way to increase our communication. So we really appreciate you being patient with us. We know that this is an impact on what you do every single day, and it hasn't been easy. Decisions that we're making have not been easy to make. So we're working really hard to get everything back up and running as quick as possible.
Yeah, thank you all. I appreciate the chance to talk to you all today. Thank you.
Thank you, Gam. All right, Chris, let's kick it off back to you. You're going to be covering social media, I believe.
Correct. I've been asked to give a quick report on the status of the social media, and then I will also be showing a preview of the NEMSIS annual data report. So for the year of 2024, we had 4 main channels on social media: Facebook, Twitter X, LinkedIn, and YouTube. So what we have now, these are the current numbers of followers. These have gone up steadily every year, and so very excited about that. I understand that we're not Taylor Swift. We're not a movie. These are great numbers for the fact that we're a technical assistance center. Appreciate all the follows and the interactions that we get from all of our great stakeholders.
Hey, Chris, can I interrupt you real quick?
Sure.
We're seeing your presenter view. Would you mind swapping to different screen?
You know what? Can we move to Jen real quick while I fix an issue here? Jen, are you ready to go? Could you go at the moment?
Yes,
Thank you.
Mine is super easy this morning. So the maintenance update, we do have a maintenance period between February 18th and 19th. As you know, we are working on other things, so there may be maintenance periods throughout. We appreciate you letting us know everything you're encountering. And while Chris finishes working on that, I did want to mention one thing. If you do need to ask for an extension, please submit it through the help desk. That way we can keep track of everything.
I have 2 quick topics too. Do you want me to go, Chris, while you're working on that?
That'd be great.
Okay. My first topic is a huge, let me turn my camera on, sorry. I want to give a huge thank you to all the states and vendors that have participated in our data quality, data missingness work. I know we have had, I think, 26 states so far, and there's more scheduled in the next few weeks that have met with us along with their vendors. And I know John and Amanda are heading this up, so thank you to them as well. But it sounds like there are some common themes we're learning as to what may be causing records to fail or go missing or not make it all the way to the national database. So we're compiling that, and we're hopeful that our public release of our data set will be more complete than ever this year. And so thank you for your work with that. And then along those lines as well, this Friday is Valentine's Day. So a little PSA to everyone, reminder. And we love EMS data. And so that is also the deadline for 2024 submissions. If you are hopeful that they will make it into that public release of the data set, we hope to get them by Friday. And there's no talk of extension. So if it doesn't make it by Friday, it won't be included. And then as quickly as possible, we will turn that around and get it ready for public release, as well as the annual report that's waiting for that data to be included. So thank you for your help in getting in those straggler records, and we appreciate that. I think those are my only 2 topics. Are you ready, Chris, or?
I think so. Let's try this again.
Okay.
So, these are the 4 channels that we worked with in 2024, and happy with these numbers. Our most popular posts on the different channels on Facebook was for congratulating Tennessee for submitting V3-5 results. On LinkedIn, it was the release of the public release research data set. Twitter no longer gives you data. X no longer gives you data on your posts, so we're not 100% sure which our most popular post was on there. On YouTube, Josh Legler's interoperability video was the most watched video of 2024. That was posted in 2024, most watched video. So congratulations, Josh. On the NEMSIS TAC website, we had 192,000 sessions generated by 97,000 users. And our most popular pages are the data dictionaries and the state maps, along with our the requesting research data. And you can see that our most popular dashboard is the non-fatal drug overdose dashboard. We did add 3 new social media accounts, so you can also now follow the NEMSIS TAC on Instagram, Blue Sky, and Threads. So if you get a chance, if you're on one of those social medias, feel free to come over and follow us on there. And this, for my next section, this is the cover for the 2024 National EMS Data Report. So this is the annual report that NEMSIS produces every year. This is all this is dependent on the data set closing and the data coming from there. So that will be, this is a product that we create based off of that data. So look forward to actually seeing this coming out as soon as we can get it out, actually, after the data set is closed. And as a matter of fact, if I have one more section, if you wouldn't mind me just getting through it here so that we can work on that. Randall, if you're okay, I'm just going to go on to finish up my section here. The NEMSIS annual report, as another thing that we're building from the annual report, we are also creating the NEMSIS annual report template, which is for data managers. Data managers, we will be providing a Word document and a PowerPoint presentation that has pre-filled national data in it, and then sections where you can add your state data and actually produce a annual report if you'd like to use this template. It's white labeled. It's so that you can add whatever information you'd like to add or remove from this report. It will have a table of contents. It'll have the introduction to NEMSIS. So if you present this to someone who doesn't understand what NEMSIS is, we've added all of the information that we usually add into our own annual report.
Hey,
and
Chris,
then, yeah.
Can you please jump down on the left side so that we can actually see what you're talking about? We're still seeing the NEMSIS TAC website 2024. Thank you.
Oh.
I think the screen sharing's frozen is the problem.
Oh. Wonderful. Live presentations are the funnest thing. So let me.
We saw a blue circle spinning, Chris. I think something was frozen.
But it
lovely.
worked when you just did what you did.
Let me try. I'm going to try starting a share again. And if this works, wonderful. And if not, we will move on. Are you seeing anything that looks kind of like a PowerPoint?
Not seeing anything yet, just you still.
Wonderful. So I think we'll go ahead and move on to Randall. Randall, are you ready?
There we go.
Oh, you got it?
Yep, introduction
Wonderful.
to NEMSIS, we see now.
Great. So you'll see a page that says Introduction to NEMSIS and has the information here that we also add into the annual report. And like I said, we have sections in here so that we have the national numbers for total numbers of activations, and then there's a section where you can have the state numbers for total number of activations, race and ethnicity, and other sections that we have in here. There will be a chart with explanations of where the national numbers are coming from, and then there will be a spot where states can enter their own information. And so that's the Word document. Then we will also have a PowerPoint presentation template where it is similar information where you can enter your information. We have explanations of how NEMSIS works, and then we'll have a spot where there are charts that are from NEMSIS and charts that you can put in. We think it's going to be a great resource for everybody to be able to use, and hopefully will take a little bit of a burden off of you to have, if you are not already building an annual report or one from scratch. So any questions on that? Or if you'd also like me to explain how to share PowerPoints in Zoom meetings, I'm happy to talk to you about the challenges there.
Are you guys looking to get rid of your XIII?
We have not talked about removing anything yet. This not being able to get the data is a new thing, and so that will be brought back to the team, and we'll discuss that.
Okay, I was thinking even for other reasons too. So,
yep,
lack of representation. Thanks. Oh, one other question: meds and procedures. So if we're submitting codes that aren't kind of on the defined list that you guys roll up to, will those still show up on those reports, or will it modify those values to something else, or just not show up, or what happens with that?
Chip, this is Clay. I can answer that. Yeah, whatever is the most frequently used medications or procedures in your state, those will show up. It's not limited to the defined list, and we don't try to collapse them, other than if many codes are used, for example, for the administration of oxygen, we do collapse those into a single code.
Okay, great. Thank you.
Thanks, Chip.
Awesome. Thank you very much. And if I could turn the time over to Randall for a NASEMSO liaison update.
Hey, Chris, thanks. My camera won't turn on. I don't know if that's it's relevant here, but I can do it without the camera. So update on the extended data definitions. The DMC members, they completed the documentation for the ePatient 14, which is the race of the patient. Middle Eastern or North African was added to the field value list. So not only in addition to that one, but we updated all the definitions to meet the Office of Management and Budget definitions. So that was actually completed yesterday, and that'll move into the full DMC for approval. Custom data elements. We did meet to discuss some of the immediate needs for the blood documentation. The DMC members have agreed on a step forward, and our DMC members are also reaching out to the individual EMS agencies and trying to gather some of the data elements that are being collected by them in their state. And then just kind of overall from the DMC, the Blood Product Administration documentation guidance can be found on the NASEMSO website. I'm going to put a link in the chat for anyone who doesn't have that already. They can go ahead and grab that from the NASEMSO website. And the DMC will meet again on February 18th, and we will have additional updates for everyone on the call. And that's all I have today, if you have any questions.
Awesome, Randall. Thank you so much. Any questions for Randall?
So what are the updates for the ePatient 14? Are they just textual changes or what?
So for ePatient 14, there was a field value added of Middle Eastern or North African.
Mm-hmm.
And then as far as some of the definitions go, the OMB document has recommendations for different words that should be removed. I don't honestly have all those words in front of me, but one of them was about having full or partial affiliation, especially when it came to the American Indian or Alaska Native. And there was some other guidance on there. I'd be more than happy to put a link for that in the chat as well from the OMB document.
Yeah, that'd be helpful, I think.
Sure will.
And would this be part of this critical patch, or is it further out than that?
I don't have an answer for as far as on the critical patch. This was work that was being started by the DMC members prior to all of this happening. So we were just sort of completing the steps on our timeline. So as far as critical patch goes, I think that's going to be more of a question for the NEMSIS TAC team.
Chip, that won't be a part of this critical patch. That is part of 3.5.1.
Yeah, David, that value was already included. The additional value for race.
I just mean like the definition changes he also mentioned.
Oh yeah, that just sits in the extended data dictionary document that's also available on the website. So those are what's being updated just to represent the OMB definitions for the race categories.
Okay.
Any other questions? All right, Chris, thank you very much.
Thank you so much, Randall. And so next we have Jeremy Kinsman, and he's going to give us a 2025-2026 NEMSIS Advisory Board introduction. Jeremy.
Hey, good morning or good afternoon to everyone. I'm pleased to announce the NEMSIS Advisory Board members for the 2025 and 2020 calendar years. Joining us will be Matthew Bergen, who is a board certified community paramedic. He has extensive experience in mobile integrated healthcare, EMS education and protocol development. Rebecca Cash will also be joining us. She'll be serving as our research representative. She's an epidemiologist and health services researcher specializing in EMS workforce and pre-hospital care systems. She has faculty roles at Massachusetts General Hospital and Harvard Medical School. Also joining us will be Randall Eimerman, who you all know. He serves as the NASEMSO NEMSIS liaison. He'll be leveraging his experience as a state EMS data manager in the past, and also his current work again in that liaison role to support national EMS data initiatives. Kurt Freeman will be joining us. He's the division chief of EMS for Boise Fire Department. He has a career spanning EMS education, quality assurance, and system development. Caitlin Honka will be serving as our EPCR software vendor representative. She works with Angel Track LLC, and she has 14 years of experience in EMS software compliance and operational modernization. Josh Legler will be continuing to serve on the board as an EMS data consultant. As you all know, he's specializes in NEMSIS implementation, data systems, and interoperability. We'll also have Stephen Johnson will be joining us. He's a EMS mobile healthcare consultant with decades of experience in ambulance service administration, reimbursement, compliance, EMS education. We'll also have Marty Link, who is the administrator for the South Dakota Office of EMS and Trauma. He'll be bringing over 22 years of leadership experience in state EMS systems. For our fire representative, David Milstein, who is the chief of EMS of the EMS branch of the U.S. Fire Administration, will be joining us. We'll also have Brian Tegmeyer, who's in our NHTSA Office of EMS. He'll be serving as our 911 expert. He's the 911 program coordinator at NHTSA and has over 28 years of public safety communications experience. And last but not least, we'll have Amber Bittinen, who will be serving as our state data manager representative. And as you all know, she's the EMS and trauma data manager for the Colorado Department of Public Health and Environment, working on driving evidence-based decision-making in EMS research and evaluation. So we're very excited. We feel like this is a great group who's going to really help us move the NEMSIS program forward. So with that, I will turn it back to Chris.
Thank you, Jeremy. Any questions for Jeremy about the advisory board? Awesome. Hearing none, I would like to turn the time over to Lauri Lunde, who is has the next two topics. We'll be talking about our data quality initiative and then talking about the 2024 record submission deadline. Lauri, go ahead.
Thanks, Chris. I actually covered those already earlier, so I will pass it to Monet. That's okay. I'll pass it to Monet to talk about our annual meeting.
Okay, thank you so much. Hello, everyone. I would like to thank you for joining the call. In case you have not heard it recently, please know that you are appreciated. We thank you for everything that you do. I want to let you know that the NEMSIS TAC is hosting our annual meeting August the 26th through the 29th in one of your favorite locations, Park City, Utah. I describe it as one of your favorite places because we enjoy taking care of you while you're in our home state. I will have a registration site, an invitation letter, and a high-level agenda, as well as the hotel link available next month. As you are aware, the NEMSIS meeting is a smaller meeting than other national EMS meetings. So please indulge me for just a moment, and by a show of hands, how many people are interested in attending the meeting? I need to see a few hands. I'm asking about David Saylor and my good friends from Florida. I see Michelle. I see a few other folks. I know the advisory board members will be there. Thank you, Chad. All right. And I want to just thank you for that because having an idea of the numbers will help with the planning process. Thank you, Kevin. So thank you so much for indulging me. I love seeing all these names, John Burkhart. And I just want to ask, are there any questions at this time? If you don't have questions at this time, please feel free to ask your questions in a submit ticket, a help desk ticket, and we'll be sure to get back to you as soon as possible. Thank you, and back to you, Chris.
Thanks, Monet. Always looking forward to the annual meeting. It's a great time, very informative meeting. Speaking of upcoming meetings, we have upcoming V3 calls at the same time and location here on February 26th, March 12th, and March 26th. With that, I'd like to open it up to the open forum. Does anybody have any topics that they'd like to discuss?
Hi, this is Chris Lucas from Emergent Healthcare. And maybe I missed it, but did we give an ETA on when we would have access to the data dictionary again?
Yeah, great question, Chris. Gam, do you have any comments? I just want to make sure that we don't miss the opportunity if you have comment.
Sorry, Ben, not Jen.
Gam.
Graham. Oh,
Yeah, I'm here. Thanks. Thanks, Clay. And I know that the TAC can cover any technical issues, but obviously there are a number of resources across the website that you all don't have access to. NHTSA made those orders to NEMSIS, to the NEMSIS team to shut those down until we can ensure compliance with the EOs. So I just do want to be clear for folks that was an order that came from us. Back to
This is Chris with Emergency Networking. I had a quick, just kind of add to that. Is that okay?
Oh yeah, please.
Gam, I guess I'm confused on why the entire data dictionary is down. Am I too simple to think that we just shouldn't access certain things, or is it that complicated, or why are we not able to access every other field aside from the two fields that are affected, or at least that's what I hear?
Yeah, I think that's a technical question, but ultimately anything that is down, it's because we can't ensure that it is compliant with the EO. But I'll kick that back to the tech.
Yeah, Ben, you can certainly kind of add details. It's a great question. We've built the NEMSIS foundation upon our Git repository, and to ensure for you that everything, when a change is made, right, that it standardizes across the entire infrastructure of NEMSIS, right? We have everything is connected together, right? So the data dictionaries are generated out of the Git repository. Of course, the XML, XSDs all kind of sit there. So there isn't like a freestanding application that generates the data dictionary, for example. So when this all first occurred, right, the idea was to bring down the things that be of consequence. And then the idea is for us to come up with ways to bring things back on board that are not related to the EO. So we're actively working right now to look for options where would be able to either resurrect some portion or some attribute of the Git repository that would allow other resources to come back on board that are unrelated to the EO. So we're working hard on this, and I imagine there'll be some solutions very soon.
Thank you.
Yeah, thank you. The only reason I ask is because I'm being asked by my team because there's a lot of projects that we are now blocked on because we don't have access to the data dictionary. So just trying to get an idea of when that might be available again so I can let them know.
Yeah. Thanks, Chris. Hey, and feel like you guys can continue to reach out to us. Every single comment that is sent to us is reviewed by the NEMSIS TAC as well as GAM's office, right? They have taken on that additional responsibility to make sure that they understand the consequences of what's happening. So we're actually quite lucky, I think, that we have an administration that is tracking so closely with us. So feel free to continue to ask those questions. We're also working on an opportunity for us to hold some kind of a town hall where we can maybe talk more in depth about technical questions and maybe brainstorm together some potential solutions. And so look for that in the near future as well.
This is Karen Jacobson. And I'm throwing this out to people because I don't have one myself, but maybe amongst the software companies and state offices, if anyone has downloaded the full PDF of the data dictionary, maybe that could be shared amongst people so that they at least have access to the PDF. Just a thought.
Aaron, I'll jump in and tell you that we as the DMC put out a message to all the state data managers, I think last week, with a link to the PDF one. So from the state side of it, if you're having issues or can't find a PDF one, I believe there's a copy on the NASEMSO DMC page, or you can reach out to one of us and we can make sure you have that.
Thanks.
Peter, looks like you have a question. How are you, Peter?
I'm well. When I recognize and respect the president's executive order and our need for compliance on a federally maintained website. My question is, say a particular state wishes to continue to allow custom values that allow that to continue to allow certain field values that may not be consistent with that, would those be allowed to be listed on the NEMSIS website after the work is done and on the much more manageable browsing of a web-based dictionary versus the PDF?
Again, would you like to respond?
Yeah, I honestly don't know that we have an answer to that question yet.
I'll put that in the chat, so the aggregation of it will be contained in the questions that are sent over to you, Gam. I appreciate you taking the question.
Yeah, thank you, Peter. Chad?
Yeah, mine was just more, my question is just more in line. Is there any updates on or is it affected with all of the things going on federally? Is there anything updates regarding the contract or the RFP or NEMSIS moving forward down the road? Is there any concern that we need to be having as states that NEMSIS itself at some point would end up going away and not be funded?
The short answer is no. So our contract, NHTSA's contract with the University of Utah, goes through the end of September of this year. And it, later this year, we'll have to go through a recompete process. There is nothing in NHTSA's contract with the University of Utah that is impacted by the EOs.
Thank you.
Any other questions? Thank you for populating the chat. Clearly, some people have taken some real time in adding your comments. Thank you for that. We'll make sure, as we mentioned, that that'll be aggregated and reviewed by the TAC as well as the Office of EMS at NHTSA. Thank you. Chris, back to you.
Awesome. Thank you so much. And thanks for the questions and the participation. Jen, would you please give us a reminder of our breakout room conduct?
Hi, hello, everybody. Once again, I am going to remind everyone that the breakout sessions are a chance for the states and agencies to be able to speak with their vendors. This is not for vendors to go into other vendors' rooms, with the exception of sometimes during the receiving process session. You should announce yourself if you're in another vendor's room. This is one of the core parts of these vendor breakout sessions, is that it gives the vendor time to speak freely with the states and agencies that join their rooms. So I have the rules of engagement up. Vendors should not attend other vendors' breakout sessions during RMP, especially for Ohio, Texas, and Alabama. They have their own hosting systems, so they may need to have vendors. Some state vendors may say, yeah, a vendor can come in during the receiving process, but not during the collect and send. And be respectful of people's times. As the NEMSIS TAC folks who are monitoring the rooms, our job is not to facilitate these discussions. If we do notice someone from a vendor and they have not announced themselves, we may just remove you from the breakout room. Please, that is just us trying to respect the vendor's breakout session that we are in. Are there any questions or concerns? And then, of course, be respectful of each other's time. That was a big concern, and we did have another vendor that was joining other vendors' rooms. So this did occur. That's why we're getting the reminder. And I believe we can go ahead. Are the breakout session rooms available?
They are now.
Fantastic. So just a reminder for the vendors who have breakout sessions this week, it is Creative EMS, Digitech, First Do, Intellitech, Oakland County Clemis, RAM, AIM Software, Star West Tech, TraumaSoft, and Zoll. Please make sure you have someone in your room, at least one person, even to attend for your vendor.
Thanks for this important meeting, everyone. Thanks, Gam, for your time. Jeremy.